Hello, and thank you for choosing Atlantic Orthopedic Specialists for your orthopedic needs. We are glad you're here, and we're eager to provide you with a pleasant experience. My name is Joanne. I am the Nurse Case Manager. I'm hoping that this video will give you an overview of how to prepare and what to expect. The hospitals all have joint classes as well. You may find these helpful, and they may have information specific to their facilities. If you're interested in attending those classes, contact the hospital where you will be having surgery, and they will be able to help you set that up. Please understand that we treat all our patients as the individuals that you are. So if your care differs from information you've gotten pre-op, that is not necessarily a bad thing. Keep all your written communication together in an easily accessible area. You will probably need to refer back to it from time to time. If you do have an email address, please provide that to us because it can make communications easier. There are several things that have to happen before you actually can have your surgery. You will need to see your primary care physician. You will need to see any specialist that you see, and you will need to get a clearance from your dentist. You will also have lab work and an EKG that has to be done prior to your surgery. You'll need to be sure that you have someone that can drive you to the hospital, home from the hospital when you're discharged, and that can stay with you at home for at least the first several days after you've been discharged from the hospital. You need to cancel any dental appointments that you may have that are within 3 weeks of your surgery, and you should not have any other kind of medical appointments, treatments, testing, or procedures for 3 months after your joint surgery. Avoid getting any injections into the joint prior to your surgery, as this will delay the surgery. You need to prepare your home by walking through and making sure you have clear pathways that a walker can get through, no loose rugs, scatter rugs, no extension cords, and if you have fur babies, you may want to consider a way to contain them so that when you're up exercising, they don't get under your feet and become a trip fall hazard. Also, no sleeping with the fur babies, and don't let them on your bed even if you're not in it, because that can cause an infection risk. You will meet with the physical therapist, and they will set up a home exercise program specifically for you, and you'll need to do that exercise program 2 to 3 times a day, every day, between now and the time you have surgery. This will get you in the best possible shape going into your surgery, which will make your recovery that much easier. You may want to consider preparing some meals ahead of time. That'll be a lot less that you have to worry about afterwards. You won't have to worry about cooking and cleaning and shopping and those types of things. Some folks like to go to the hospital ahead of time and make sure they know where they need to park and where to arrive so they don't park at one end and wind up walking to the other end of the campus. After your surgery, you will need some things at home. You're certainly going to need a thermometer so you can monitor your temperature. If you have a tub shower combo that you have to step over, there is something called a tub transfer bench, and that will make your ability to get in and out of the tub safer and easier. If you have particularly low commodes or are tall, you may want to consider an elevated commode with some arms on it to help assist you back up off the commode. This equipment is not covered by insurance. It is readily available in local stores, pharmacies, Walmart, Home Depots, those types of stores. You can get them online, and we will provide some links for you to look at them. And frequently you can find them in the thrift stores, because once folks recover from their surgery, they donate those types of items. Before your surgery, you're going to need to stop taking aspirin 10 days before your surgery. If you take Coumadin, you need to stop that 5 days before your surgery. And check with your primary care and your cardiologist to see if they want you to take anything else in the meantime. If you take Plavix or use Motrin, ibuprofen, any anti-inflammatories, Aleve, Naproxen, those types of things, they have to be stopped a week before your surgery, as well as any herbal supplements or vitamins E, C, or K. You can continue taking Tylenol, Celebrex, Mobic, or Meloxicam Ultraset, glucosamine and chondroitin, iron supplements, or Ultram right up to the time of surgery. Once you've made the decision to have surgery, you will need to pick up daily multivitamins with iron, vitamin C 200 milligrams daily, and vitamin D 2,000 units daily, and start taking those. You will also want to have on hand some 81 milligram aspirin tablets, stool softener like Colace or Miralax, and extra strength Tylenol. These will be used after your surgery. The night before your surgery, you should hear from the hospital, and they will tell you when to arrive and what medications you can take the morning of surgery, if any. They will also tell you when to stop eating and drinking. It's usually midnight the night before surgery, but if you have a late scheduled surgery, they may let you have a light breakfast. The morning of surgery, you'll need to arrive at the time that the hospital designated for you, usually about 2 to 2.5 hours before your surgery. You need to bring your photo ID and your insurance card, and you need to leave your valuables at home. Post-operatively, you will probably be on a narcotic to control your pain. You may have Tylenol prescribed as well, possibly Mobic or meloxicam. They may give you a medication to help protect your stomach, and again, the stool softeners like Colace or Miralax to prevent the constipation caused by the narcotic pain relievers. You'll begin your physical therapy at the hospital. They're going to get you up, get you walking, have you practice on stairs, and they'll make sure that you have the walker or cane that you need before you leave. Do not be discouraged if on your second day post-op you don't do as well as your first day. If you receive a block for pain, the second day post-op you may experience more pain as that block will have been worn off. So do not let that discourage you. We will work with you to manage your pain once your block has worn off. Your physical therapy needs will be determined by your physician after surgery. Most folks go home with a home exercise program. If you need more than that, as far as outpatient physical therapy or very seldomly home health, we will assist you in setting that up. You're going to have mild bruising and swelling the first day or two at the surgical site. As time progresses, the bruising and swelling may as well. You may have swelling all the way down to your foot and ankle, and this is all normal. There is several things you can do to help prevent the swelling. We use the acronym RICE, which is rest, ice, compression, elevation, and exercise. This is where your part becomes critical in your recovery. Don't sit for more than an hour at a time without moving around. Get up, take a few steps, do some exercises. Stiffness is the enemy. The longer you sit, the stiffer you get, the more your pain will bother you. If you're resting, your legs should be elevated and it should have ice on it. If you'd like to use some compression garments like biker shorts or something like that, or support hose or anti-embolism stockings or anything like that to provide compression to the area, you can do that as well. Icing and exercising becomes a circle. You rest, you ice, you elevate, and you exercise, and then you repeat. The harder you work on these exercises, the quicker your mobility comes back, the quicker your pain level will decrease. You'll have a waterproof dressing on when you come home from the hospital. That stays on until you come back to see the doctor post-op. It's normal to have a little bit of staining on the dressing. You can circle those stains with a pen if you like, and that way you can tell if it's continuing to drain or not. If you have any edges or anything that become loose or rolled up, you can trim those off with a pair of scissors or reinforce it with some first aid tape. Right around 2 weeks of surgery, you will see your doctor for your follow-up. That appointment may have been given to you when you got your surgery date. If not, when you come home from the hospital, you'll want to call our office to set that 2-week appointment up. You can start using heat to the surgical area. Some folks find that if they apply heat before their exercise, it helps loosen the muscles up a little bit, makes it easier. And then, of course, when you're done exercising, you're going to want to elevate and ice. If you don't find the heat helpful and you prefer the ice, that's perfectly okay. We want you to work with what's going to work best for you. If you have a fever of 101.5 consistently, if you have any drainage after 7 days, if you have pain that's not controlled, if you cannot put weight on the leg, you have a foot that has no sensation or is discolored in appearance, or you have any confusion or disorientation, please contact us. We do provide Ortho Now or hours from Monday to Friday at our Kempsville, Camelot, and Chesapeake locations. There is no appointment needed. You just come in and you'll get the prompt personal care that you deserve. If you go to the emergency room, it's likely to be a much longer process, and they're going to refer you back to us the next day. I'm sure you realize that joint replacement is not to be taken lightly. You will need commitment from a good support system and from yourself. There will be some pain. We will provide medication to help you with that. Doing your exercises and icing are key to getting that to subside. We do everything we can to make this successful for you. Ultimately, your outcomes are up to you and the effort you put into them. The AOS team is here to help you in any way we can. Thank you for trusting us with your care.